Hi everyone, Dr. Andy here, and it is time for today's Facebook Live. I will give you all a brief introduction to who I am and allow everyone some time to log on and join our live today. I am 1 week out now, coming back from Hong Kong. We had a fantastic event out in Hong Kong last week. I got back early last week. We had a really incredible Keto Academy in Hong Kong, a fantastic crowd. We had a really great time, and it was exciting, wonderful to have the opportunity to speak in another country, speak about ketones and Prüvit. So it's wonderful to watch the community grow. So that was an incredible time that we had over there. So I'm so happy that we get to share that. I know some of them log on to the lives as well. So it was a really wonderful experience to watch where Prüvit is going. Again, as we give people time to log on, I'm going to give you a brief introduction to who I am from those of you who are new. So again, I'm Dr. Andy. I'm a naturopathic physician. I've been practicing in Toronto for 10 years now. I have been with Prüvit from the very beginning. I'm an educational specialist, so I like to answer all of your questions. I love to hear your stories. I focus a lot on the clinical applications, or how I use the ketogenic diet and exogenous ketones in practice. I work in a clinic with about 19 other practitioners, and we have medical doctors, osteopaths, nutritionists, naturopaths, and all of us work from a low-carb standpoint, with the foundation being keto, ketogenic diet, exogenous ketones as really the foundation of most of our protocols and most of our treatment plans. So I do have a lot of patients who are currently following ketogenic diet and taking our exogenous ketones. So let's get into the questions. I can see your questions coming in already. So to make sure that I answer as many as I can, I will try and get through them. Let's get started. So what happens if someone drinks ketones, but they're still consuming sugar? What happens to the sugar? So a few different things will happen. So I always like to say, taking exogenous ketones can't make up for all of our unhealthy food choices. So if we're eating a ton of sugar, absolutely the ketones, since they improve insulin sensitivity, will help to lower blood glucose levels. So it helps to pull some of that sugar out of your blood. However, again, if you do still have excessive amounts of sugar, that will still get stored, so it can't make up for all of those choices. But yes, it does help to decrease those blood sugar levels, which helps to maintain a more steady energy and blood sugar level. And I'm going to tie that into the weight loss question, because I'm seeing some questions about weight loss as well. So I always like to start by saying that ketones are not, exogenous ketones are not a weight loss supplement. But you experience weight loss due to those secondary benefits. So for example, as I was mentioning, improving insulin sensitivity, decreasing blood glucose levels. It also impacts our hunger and satiety hormones, so leptin and ghrelin. So there's a direct impact on our appetite, so it can actually help to decrease our appetite. There are also some other things that impede weight loss, like inflammation, microbiome dysfunction. So those are some things as well that could potentially be addressed. So then the secondary benefit of all of that is weight loss, which I like to refer to more as body composition change, which is losing fat mass and maintaining or building muscle. And no, you don't have to follow a ketogenic lifestyle to experience the benefit. That's actually one of the wonderful things about exogenous ketones. For those of you who have tried a ketogenic diet, it can be quite difficult. It's something, I've been ketogenic for many years, and I've been introducing it to patients, and so I do understand for some people it's not possible. For some people it's a challenge, and going keto just isn't an option for them. Following a ketogenic diet also for some people it can take 2 weeks, other people it can take months before they even get into nutritional ketosis. So that's absolutely one of the benefits of exogenous ketones. For those people who can't follow or aren't able to follow a ketogenic diet, they can absolutely take exogenous ketones and still experience the benefit as if they're in nutritional ketosis, because you will increase your blood ketone level, your body will still use those, and we have bioidentical ketones, so the absorption is extremely high in the keto products, Keto Max, Keto Nat, extremely high absorption, so you experience the benefits as if you were in nutritional ketosis. And I saw a question as well about those who are already following a ketogenic lifestyle. So Jacob and Ryan actually presented a study that they did looking at the benefits of those who follow a ketogenic diet or just take ketones, or take ketones and follow just a standard diet. And what they found was you do experience great benefit if you're following a normal diet and take exogenous ketones, but the greatest benefit you experience is when you pair exogenous ketones with a ketogenic lifestyle. So I've been ketogenic for 10 years, but adding in exogenous ketones enhances the benefit. So it doesn't stop your body from producing your own ketones, but essentially what it will do is it's an amplification. So it just increases your blood level of ketones. Question about diabetes. So can diabetics take exogenous ketones? So diabetics are the people who would have to be careful when taking exogenous ketones, specifically a type 1 diabetic. The concern is always something called diabetic ketoacidosis, which is extremely high levels of ketones in the blood. But when we say high levels, we're meaning levels upwards of 20. So when we're in nutritional ketosis or taking exogenous ketones, our levels can range anywhere from 1 to 3. So we're not getting anywhere close to those levels like at the 20 where people are going to be concerned. And as long as you have insulin in your system, you cannot go into ketoacidosis. We have sort of a feedback inhibitory effect in our body. So if there's insulin, you cannot go back, you can't go into ketoacidosis. So obviously type 1 diabetics, since they don't produce insulin, would have to be careful to make sure that they are taking their insulin. They have to make sure that they are a controlled diabetic. And I encourage them to monitor their blood ketone levels as diligently as their blood glucose levels. And the same would be the case for late stage type 2 diabetics if they're also on insulin. So it's just those people who are taking insulin, they have to make sure that they are controlled diabetics. And again, working with their healthcare provider to make sure that their healthcare provider says that it's safe for them. So information on ketones and depression. So there's some really interesting information looking at the role of ketones and mental health. So some information looking at depression and anxiety, specifically when it comes to serotonin and GABA. So serotonin and GABA are neurotransmitters in the brain, so they're the chemical messengers in the brain. And disruptions in serotonin and GABA are often linked to depression and anxiety. So you might have heard some people end up taking GABA supplements and things like that to help manage their condition. And what the studies are showing is that beta-hydroxybutyrate actually encourages the production of GABA. So we have this other compound called glutamate, and glutamate is converted into GABA. And beta-hydroxybutyrate encourages that conversion into GABA. Glutamate is an excitatory neurotransmitter, can cause a bit of neuroinflammation, and GABA is an inhibitory neurotransmitter, so it's very calming. So it's calming to the nervous system. So there's some really interesting information right now in research looking at the role of ketones in anxiety and depression. And also when it comes to serotonin, we know that 90% of our serotonin is made in the gut, so our gut health is essential. And there's some research that shows that beta-hydroxybutyrate encourages the production of healthy gut bacteria. So there are a few angles where there might be benefit when it comes to mental health, although you do have to remember that exogenous ketones won't cure any medical condition that you have, and so you do have to work with your healthcare provider, but there's some evidence to show that it could be beneficial. So how do you handle loose stools while drinking ketones? So that's a great question. So there are often a fair bit of so we often do hear that people experience some gastric or digestive upset when they begin taking exogenous ketones or MCT oil, so medium chain triglyceride fats. And so what I usually suggest is that you just start at a lower serving. Your body is just adapting and learning how to make use of those ketones, so essentially reduce to a half or even a quarter of a serving. I generally encourage my patients to take ketones on an empty stomach. But if you find that that makes it worse and it makes the loose stool, or again, some people might get a little bit of acid feeling in their stomach or reflux feeling, if that's the case, reduce how much you're taking and take it with a small meal, but a meal that's higher in fat. So again, I do like the ketones on an empty stomach, but if you do eat when you're taking them, then consume it with a meal higher in fat, some avocado, eggs, something like that, to see if that helps, and slowly work up to a full serving. So do ketones increase joint mobility? So ketones, we don't have evidence that show it's going to increase your joint mobility. What we do know is that there is some research looking at ketones and inflammation, and that there could be a potential benefit in our inflammatory cascade. So it's possible that there's a side benefit from joint mobility, but I haven't seen any research specifically linking beta hydroxybutyrate and joint mobility overall. So what about ketones if you don't have a gallbladder? And I'm actually going to tie that in a bit to the liver and kidney health as well, because I've seen a few questions about that. So if you don't have a gallbladder, you absolutely can consume ketones. The concern mostly with individuals with a gallbladder is consuming diets that are high in fat. It's diets that are higher in fat. If you don't have a gallbladder, it's hard to break down and digest fat. So consuming fats in the diet can cause a lot of digestive upset. But taking exogenous ketones will not have that same impact. If you are following a ketogenic diet, what I generally suggest, and even if somebody's not following a ketogenic diet and they don't have a gallbladder, my suggestion is always a digestive enzyme that contains ox bile, and that will actually help with your fat digestion. I never want anybody on a low-fat diet. We need fat to make hormones. Our cells and our brain need fat. They're made from fat. So I never encourage a low-fat diet. So when the gallbladder's been removed, I encourage a digestive enzyme with ox bile. So when it comes to liver and kidney health, and I saw some questions about kidney stones as well, with the ketogenic diet, there has been some evidence that shows there's a potential link to kidney stones. But generally what we see is if you add in a potassium supplement, that effect is greatly reduced. So it's essentially just a mineral imbalance. So if you are concerned about kidney stones, we haven't seen that link with exogenous ketones, but if you are concerned about kidney stones, then I would just add some potassium supplements into your supplement routine. And we haven't seen that exogenous ketones or the ketogenic diet are detrimental to the health of our liver. We're actually seeing the opposite, that the ketogenic diet can be quite helpful, especially in situations like fatty liver, for example. We know that fatty liver is caused not by fat, but by sugar. So if someone has fatty liver, what they need is a low-carb, higher healthy fat diet, not a low-fat diet. And again, some of the evidence shows that the beta hydroxybutyrate actually supports the function of the liver overall. So there is benefit. There could be some potential benefit to your liver health overall. So how long will it take you to lose weight on a ketogenic diet? So I do love that question. And I get that question a lot when it comes to weight loss. And what I tell everyone is you have to be patient. Especially if it's a man compared to a woman. Men and women often lose weight at different rates. But everybody will lose weight at a different speed. It just depends on your personal metabolic state. It depends on your inflammatory state, your gut health. There's so much that can actually contribute to weight loss overall. And so what I generally tell people, you have to make sure everything is on track, and you have to understand that when you make these healthy changes, when you introduce exogenous ketones, even though you don't see that number changing on the scale, it doesn't mean that there aren't things happening internally that you can't see. So again, the microbiome health, and again, are you addressing hormones? Are you in menopause? Have you addressed thyroid health? So all of those things come into play. So I always tell everyone to be patient. You have to give yourself time. And I've seen lots of weight loss questions today, actually. Will you lose weight? Again, exogenous ketones are not a weight loss supplement, but we experience that weight loss because of those secondary benefits. What I also always encourage is measuring your body fat. So do a bioimpedance analysis. Measure your body fat and your muscle mass, because often what is happening is we're losing fat and building muscle, and so the number on the scale isn't changing, but our bodies are changing. So also look at how your clothes are fitting. All of those things will impact. So everyone will lose weight at a different rate. So I just encourage you to address all those other things as well, and then to be patient while your body heals. If you've been overweight for a long time, you didn't get there overnight, so it's going to take you more than maybe 30 days to lose all of that weight if it took you years to get that on. So again, we don't want crash diets that are going to cause you to lose ridiculous amounts of weight in a short period of time and then you just gain it all back. It's sustainable, healthy body composition change. So with exogenous ketones, how long do you stay in ketosis? That's also dependent on how quickly your body will use them. It could be anywhere from 3 to 6 hours. So again, it depends on if you're taking it before a workout, you'll probably use it a little bit faster. So it just depends on your body's need and your body's demand for that source of fuel. If you're not exercising, it'll probably stay in your system for a little bit longer. But if the demand is higher, it'll get used a little bit faster. So anywhere from that 3 to 6 hour mark. So that's why some people do choose to take it twice a day, just to see if there is, just so they get that greater benefit and have those ketones in their system for a longer period of time. When people are first starting, I often encourage just to start with 1 pack a day and figure out the best time of day that works for you. But I do generally add in a second pack in the afternoon. And I do find that that's helpful as well, just so we keep those blood ketone levels up. So Lyme disease and therapeutic ketones, I've seen that question a couple times in here, so I will address that as well. So when it comes to Lyme disease, again, exogenous ketones are not a cure. It's not going to cure any medical condition. Lyme disease is a bacterial infection. So there's a whole other treatment protocol that you need to treat that bacterial infection. But there are a lot of symptoms of Lyme disease overall that can be managed or addressed through a ketogenic diet or exogenous ketones. When it comes to using the ketogenic diet or ketones, trying to manage as a therapeutic tool, that's where I encourage changing your lifestyle as well. Oftentimes I'll tell people taking exogenous ketones is fine. In a situation like Lyme, I want exogenous ketones and I want a ketogenic diet. And when it comes to Lyme disease, a lot of the symptoms are fatigue, brain fog, neurologic conditions, numbness and tingling in your fingers. A lot of the things that the research would indicate beta-hydroxybutyrate could potentially help with. So I introduce for all of my Lyme patients, we've been treating Lyme here for about 5 years now, so all of my Lyme patients are on exogenous ketones and all of them are on a ketogenic diet to help with symptom management while we're treating Lyme overall. But yes, everybody is put on a ketogenic diet, and that's actually the foundation of all my Lyme protocols. It's ketogenic diet and exogenous ketones, and that's the first 2 things all Lyme patients get, especially for that mental focus and the brain fog. And I do introduce intermittent fasting, and I do encourage the reboot as well. And the intermittent fasting and the reboot is actually makes quite a significance there as well. So I absolutely always introduce those exogenous ketones. So can somebody with vertigo take exogenous ketones? Absolutely. It's not going to negatively impact vertigo in any way. Feel free to check with your health provider as well. But yes, absolutely, you can take it if you do suffer from vertigo. So what's a good gap between serving 1 and serving 2? And I saw another question about, so I'm going to lump this together actually. I saw another question about fasting a little bit earlier, about intermittent fasting, and about breakfast and when to space out the keto cream. So I'll put all that together. So a general layout, if you're introducing that intermittent fasting, which I do encourage that everyone start, that's something I do pair. Even if people can't follow a ketogenic diet, I do have them start with the intermittent fasting and the ketones, and that's a really great prep for the reboot. For some people, going right into a reboot can be a little bit tough because it's taking that intermittent fasting and extending it, and some people aren't able, and their body's not quite able to tolerate that extended fasting if they've never done it before. So I encourage that intermittent fasting at least 4 times a week. In that intermittent fasting window in the morning, the way I generally stagger it is coffee. You can have your keto cream mixed in whichever beverage you would like, and then about an hour later, your exogenous ketones. You can absolutely take them at the same time. I often space it out, so I do the coffee at home, and then I bring my ketones to work, and I just sip my ketones in the morning when I first start. And then that second serving or that second pack in a day, I generally encourage sort of around that 3 o'clock mark where that energy dip most people are starting to experience. So around 3 o'clock, that's where I'll encourage adding it in. Or if you work out in the afternoon or the evening, take it 30 minutes before your workout. So that's often how I encourage staggering it, and that's a really great prep to lead up to the reboot. So I encourage that intermittent fasting, 12 hours, 4 times a week. Once a week, I have my patients extend it to 24 hours, and then once monthly, it's that intermittent fasting that's extended with the reboot. And so that's a really great prep to get into that longer period of time. So I find that schedule works. Quite well. So how quickly should you drink the ketones? So it depends on how high you want your blood ketone levels. If you drink it all within that sort of a 30-minute period, or even less, you just get a higher blood ketone level. But there are some people who feel great when they space it out through the day. And so if you want to space it out and you still are experiencing the benefit from it, then that's no problem at all. If you're spacing it out and you're not quite experiencing the benefit that you're looking for, it might be that you're not getting your blood ketone levels high enough, so then I encourage drinking in a shorter period of time. So maybe that's a 10-minute period of time. During workouts, I'll space it out, so I'll always take ketones. I'll drink sort of half of it before my workout, and then that's what I'm sipping on during my workout, so it's sort of a continual source of ketones in my system. So that's sort of how I personally space it out, but if you do want that higher blood ketone level, then a shorter period of time would be better, just to get those higher levels. So, okay, so checking your keto strips. Okay, if you take and you're still, okay, perfect. So the question is essentially when to check your ketone levels. Get that question a lot, or some people saying they've checked their ketones, urine or blood, and they're not getting a ketone reading. So there are a few ways to make sure that we're testing properly. The first is that we want to test blood ketone levels, not urinary ketones. So ketones are water soluble. So what that means is when our body makes them, if we don't make use of all of them, they're eliminated through the urine. So they're not going to accumulate. They won't be stored as fat, which is what happens with carbohydrates. They're not going to spike our insulin response, which is also what happens with carbs. So if our body doesn't need everything we've created, it comes out in the urine. So that's often the rationale for testing urinary ketones. But as we become more keto adapted, or depending on the day and our need, if our body needs all of those ketones, it's not going to eliminate them through the urine. So if you're doing urine testing, you might get a low reading, which isn't accurate. It doesn't mean that you don't have ketones in your system. It just means your body's not eliminating them in your urine. So I encourage testing your blood. If you're only taking exogenous ketones, I encourage testing blood ketone levels 1 hour after taking your ketones. So some people would say that they'd take their ketones in the morning and then test their ketones at night before bed. But as we were talking about a little bit earlier, the ketones will only stay in your system anywhere from 3 to 6 hours. So if you took ketones in the morning, they will be out of your system by the evening if you haven't taken that second serving. So taking ketones in the morning, testing at night won't give you an accurate reading. So if you take them in the morning, test them within the hour. And then if you take them in the evening, it should be after you've taken your exogenous ketones, just to ensure that you have an accurate reading. So epilepsy and ketones, another great question. So we know that the ketogenic diet was created by a neurologist to treat seizures in children with epilepsy. So that was really actually the foundation of the ketogenic diet. And I was talking a little bit earlier about some of the neurologic effects of ketones and what the studies have found. Initially, they weren't 100% sure what it was about the ketogenic diet that was conferring that benefit to those with seizures. And then the diet lost favor a little bit when the drugs came out. But today they still use the ketogenic diet when someone has drug-resistant epilepsy. So that is something that is still used. And what the studies are finding is that beta-hydroxybutyrate can actually help to bring down some of that neuroinflammation. And there's some research showing that there's even a neuroregenerative aspect to beta-hydroxybutyrate, which could potentially be conferring the benefit that they're seeing there. So if you do suffer from epilepsy, you obviously have to work with your neurologist, but they should be well informed. Neurologists actually should be the most informed about the ketogenic diet, since that's really what it was started for. But there is some really great research looking at that neurologic benefit, epilepsy, and ketones. So what happens to glucose when you're in nutritional ketosis? So this is the thing, when you're in nutritional ketosis, the only way to get into ketosis is because we have a low carbohydrate diet. That's the only way that nutritional ketosis can happen. So essentially it has to be low carb, moderate protein, high fat. That's the only way our body will move away from using those the carbohydrates as fuel to using fat as fuel. So the body will use those sugar or glycogen stores. It will use that and slowly transition over to starting to use fat, to use that fat for fuel. If you're a high carb and high fat diet, you cannot go into nutritional ketosis, which is where exogenous ketones can be helpful. Coming back to the weight loss question, actually, that's another thing that I quite often see. When people start taking exogenous ketones, they start to learn a fair bit about the importance of fat. So they haven't changed their diet very much, but they've added the healthy fats in, which is great, but what that means is you're now high carb and high fat. So that's one perfect way to gain weight when you're high both. So you have to have the right balance between the two. But again, in nutritional ketosis, we will have used those glycogen stores, and now we're moving over to use our fat stores. So obesity, lots of questions on weight loss. Today's the weight loss day, and the keto reboot and the reboot as well. So is the keto reboot similar to a fat fast? No, they're quite different. The fat fast is essentially where you're just consuming fat. That's what the fat fast is. The keto reboot is where we're consuming bone broth, ketones, the tea in the evening that also has exogenous ketones. You can have water, coffee, tea, but the fat fast, you actually are consuming food, but it's just all high fat foods. That's what the fat fast is. So the reboot and the fat fast are a little bit different. And then the reboot is 60 hours, where in that period of time, it's essentially a liquid diet. So we're not consuming the high fat foods. We're just consuming, again, the ketones and the bone broth. So they're a little bit different. And there's a shorter period of time. The fat fast can often be a little bit longer than that. But it is a really great way to, again, to break your carb addiction and things like that, because you are cutting all of your carbohydrates out in that fat fast. But you are consuming fats, where in the reboot, it's a 60-hour fluid intake, essentially. All right, Hashimoto. So actually, I didn't get very many autoimmune questions today. Usually that's sort of top of mind in the Facebook Lives. Today was the weight loss focus. So Hashimoto, so that's a great question, and now we'll come in a bit to autoimmune. So often the question is, will taking exogenous ketones throw off your thyroid hormone? And that question generally stems from the fact that if you Google, a lot of times people will say ketogenic diet throws off your thyroid hormone. So the only time that you're going to throw off your thyroid hormone is if you're following a low carb, low fat diet, which people often call a ketogenic diet, but that's not actually a ketogenic diet. They're essentially eating chicken and lettuce all day long, and you need that fat. That's what the ketogenic diet is. It's that higher healthy fat. Our bodies need fats. Our body needs fat to produce hormones, and all of our hormones, our sex hormones, are highly linked to our thyroid hormones. So if you're on that low fat diet, you will disrupt thyroid production. So when you do a ketogenic diet properly, you should not disrupt your hormonal balance. And we do not see that taking exogenous ketones will disrupt thyroid or sex hormones for that matter. And with Hashimoto's, we do know that that's an autoimmune condition. This is one of my favorite topics to talk about when it comes to autoimmune. So we know with autoimmune, we have underlying inflammation, we have underlying mitochondrial dysfunction, and we have low BDNF that can contribute to a lot of those, and oxidative stress actually, that can contribute to the onset of an autoimmune condition. Most people can pinpoint the stressful event that occurred right before the onset of that autoimmune condition. And so when we look at the research, we know that we're seeing now that beta hydroxybutyrate can actually increase mitochondrial function And mitochondria is kind of like the generator of the cell. That's how our bodies produce energy. Our bodies need to have the mitochondria that function properly. So when it comes to autoimmune, often the mitochondria is not functioning the way it should. And the research is showing that BHB can actually improve mitochondrial function. It can also improve the production of an antioxidant called glutathione. Glutathione is a key antioxidant. Not only does it also help to fuel that mitochondria, but it also helps to manage some of that oxidative stress damage. So essentially what that means is when we have a very stressful event, we create these little particles in our body called free radicals. And what we need to do is find something to grab onto those free radicals because they damage our cells and our DNA. So beta-hydroxybutyrate has been shown to improve glutathione, which is an antioxidant that can grab onto those particles that are moving around and causing a lot of damage. We also know that it upregulates something called BDNF, the brain-derived neurotrophic factor, which is responsible for creating new neuronal pathways in the brain. And they're finding that beta-hydroxybutyrate can upregulate BDNF, and intermittent fasting and extending that intermittent fast can also do that. So again, although exogenous ketones in the ketogenic diet will not cure any autoimmune condition, there are a lot of underlying components that you can try and address from a symptom management and just to optimize your health outcome overall. So I think that is all the time I have today, guys. I've missed so many of your questions. I see tons of questions that I'm still scrolling through. I hope I got to most of them. I'm seeing some questions on fibromyalgia. That's the same question, the same answer I just asked or mentioned for Hashimoto's. That's still an autoimmune condition, and that does fall into the autoimmune perspective. And I am going to answer the last one on hair loss, because I do get that question a lot. So no, exogenous ketones shouldn't contribute to hair loss, nor should the ketogenic diet if followed correctly. So if you're following it with a higher fat diet, you're not reducing your fat intake, you're making all the hormones that you need, then you shouldn't experience hair loss, but you should address the other things like low estrogen, if you're going into menopause, changes in progesterone, thyroid, B12, low iron, and stress. All of those things contribute to hair loss. So lots of other things to investigate there. So I hope I answered all of your questions, guys. If not, hopefully I can answer some as I scroll through. And if you see me at the next event, please come and say hello. Share your story. I always love to hear those or ask any questions. So enjoy the rest of your week.